You had questions. I got you answers. Make sure you're following if you like when I lay stuff like this down. I told you I went to Washington, D.C. this week. I went to the White House, went to the Eisenhower Executive Office building, sat down with Secretary Doug Collins of the VA. Veterans are concerned. Veterans' families are concerned about VA facilities, about cutbacks on workforce, about whether the services or the health care is going to be changed at all for the worse or for the better. I asked him all those questions that you gave to me, and here are his answers. Here at the Eisenhower Executive Office building in Washington, D.C., sitting across from Doug Collins, who is the VA Secretary. First of all, thanks for coming on, man.
Thank you, Joe. Appreciate
really good to see you in person. We've had you on a million times in the past.
Yep.
I just think you're doing a great job. I want to start with this. I'm on social media.
Yep.
I have almost 1 million on TikTok, about half a million on Instagram. And the question they want to ask me constantly is so full of BS, but it's from the left.
Yep.
It's from the media.
Yep.
Why are we getting rid of 80,000 VA? Why are we harming the care for the veterans? Why doesn't Doug Collins care? Obviously, I know the truth.
Yeah.
But how would you react directly to them if they said it to you?
Well, here's the question I ask: is why are we settling for a system that over the last 10 years GAO has said is on the high risk list for poor quality care, poor patient recruitment, and also fraud and abuse?
Right.
Okay. So my question is for the last 10 years you've thrown hundreds of billions of dollars, literally, and hundreds of thousands of employees at a system in which your statistics and metrics have gotten worse.
Right.
So my question back is why are you invested in a failing system? I'm not invested in a failing system. I'm invested in one thing only, and that's the veteran. And for those out there, especially on the Democrats on the Hill, unions and others who have a vested interest in keeping it bad, in my opinion, I just, my question is why are we doing things this way in which we know we have problems? And instead of saying, well, let's fix it, you've already shown money's not fixing. You've already shown people aren't fixing.
Right.
So maybe the question is inherently our structure is broken. And so they're scaring veterans. That's what they want to do. But
that's exactly right. No,
that's all they're doing.
They are scaring veterans because it's working. But here's what I always retort, Doug, and I think that you're with me on this. Let's say there are 450,000 that work at the VA. Let's say you cut 80, which you haven't even done yet, right?
No,
I mean,
that's the crazy part.
Yeah, they claim that you just took a hatch and just cut them out. Let's say you cut 80.
Yeah.
That's going to leave us with 370. Do we know if that's enough? Do we have any idea how many people we need? It could be 100,000 you need at the VA. You might be able to cut 300,000. So they're making numbers up as if 80,000 is a tangible number that takes something away that they already have.
Yeah, I think that's the problem. We've never asked the real questions, and that's what we're actually doing now is what do the people do where we're at? Do you realize that probably out of that we have literally thousands of doctors, thousands of nurses who never see a patient?
Wow.
They move
Never.
paper. They move paper. That's all they do. They move paper or they make policies. We have 170 hospitals that all tend to act independently from each other, not as if they.
How's that possible?
Because of years of neglect in the sense of having good management of not only your personnel, but also fiscal management. And I think this is the interesting thing that I tell everybody. In the last 10 years, when that GL report I talked about, do you realize that we've lost almost 4 million veterans in that time, literally from our population? We've lost almost 4 million veterans, and the enrolled population in the VA has stayed constant at 9 million.
How's that possible?
Because we have some of our new ones come in, but some of our old ones die off. But we'll never reach all of our veterans. We just never have. But think about that. 10 years ago, we had almost $200 billion less in budget, and we had almost 150,000 less in personnel.
Right.
And now we're still treating basically the same amount enrolled.
Makes no sense.
That means that there's a lot of, we have a lot of acute care. We have a lot of stuff that's going on in our aging population. But we also have facilities in our country that are at 40% occupancy this morning. I just got the report. They have 40% occupancy in their beds. I've got some that are 100%. But yet we have a system that's designed to treat every one of them as if they're the same.
Right.
That's just foolishness.
You and I talked about this before. It's VA Secretary Doug Collins. The fact that we've got facilities that are 40%, maybe in some that are 20 or 30%, and you're paying for the lights and the water and the infrastructure and the rent and whatever the hell else we're doing there, wouldn't it be more efficient just to let them go to their private practice doctor in town and we pay for it? Doesn't it make sense?
There's a lot of that.
Could we save money that way?
It could. And I think what you got to have is a balance of our VA care and of community care. But here's the problem. My predecessor and the previous administration had done away with basically community care. They were selling the VA. They thought the VA had to sell itself as if it was a entity out there grabbing as many people as they can.
Wow.
Well, they only have a finite population. That's the veteran.
Right.
So to think about that, they were basically, so let's translate that into real world. Save our jobs and save what we're doing. Save the union payroll here. We're just not going to play that game. And so what we're doing is finding ways. But there's a other issue here that for folks who are listening to this, I want you to understand, that on some of our places that are not as busy, you have clinicians who are not getting the skills and the training. They're not seeing people enough in the days that actually degenerate their actual quality.
Yeah.
So we're having to balance this. So this is why we're taking a hard look at this. By the way, for anybody out there that gets on your social media, Doug's going to close I cannot close a hospital. Statutorily, I cannot close any hospital. But you know what? Congress had the ability to a few years ago through the Air Commission, where they looked at all of our assets. Senate voted for it 100 to nothing, basically unanimous. Okay, unanimous consent out of the Senate for this bill. When they formed the committee after they did these market assessments, the Senate sat on it. The tester and the VA committee sat on it and basically let the commission expire without doing anything.
Is it VA Secretary Doug Collins? Thanks so much for taking the time here at the office building. Is what happened before Trump won fixed? And here's what I mean. In Phoenix, you had veterans dying.
Yes.
They were lying. They're fudging the paperwork that they got appointments. They never got appointments. People didn't get care. They just kept on recycling, pretending that they were, and they were dying off. Has that been fixed? Because I know President Trump said that he couldn't fire people, but then he did anyway.
Yeah,
he fired like 7,000 people. So is that fixed or not?
Yeah. By the way, Biden administration either brought them back or paid them off. Those 6,000. And some of these, let me just rephrase you. These were not just people who they just randomly fired. These were people who showed up in an OR drunk. Okay, think about that. You had a nurse show up drunk. It's still a binding to us, but we're we're working on human resources. Are some of those fixed? Yes. But are some of them still a possibility? I see pop-ups of issues where we have some backlogs that are growing, and so we're working to fix those as we go.
Why do we have anybody who's unfireable in the government? You guys work for us. I mean, everybody's fireable. I mean, I never understood that. Are there people that are somehow tenured at the VA? What is that?
Most of them are collective bargaining. We have 470,000 employees, and 80% of those are collective bargaining. So it is a problem. Now, but my problem is, though, you can still fire people, but we've lost the ability to know how to write somebody up, counsel them, get them better, give them an opportunity, and then when they don't, get rid of them.
Yeah.
But we're training a generation of managers inside the VA who never understood that, never had it followed with them. They never understood counseling. They never understood it. It's been the most interesting thing for me is some of my staff has come in and started actually counseling people on bad work. And when
Can you imagine?
And when I actually bring them in, or like I get a report across my desk about something that went wrong, and I said, what happened to this employee? And they said, well, we don't know. I said, we'll find out before I sign this paper. I'm not going to sign it until you tell me if there was some kind of a discipline.
It's Doug Collins. He's the VA secretary. Only a couple of minutes left. Let me ask you a couple of things. Very specifically, are you going to cut the staff? And will that have anything to do with cutting any benefit for any veteran who deserves it?
Second part first, no benefits, no health care is being cut. That's just off the table. It's just off the table.
Okay.
Because really, most of that statutory, you've earned it, you get it. But then are we going to probably have less staff by the time I see you in 100 days? Probably so. And that's not a bad thing. But also we're looking at it from a perspective, there is such bureaucracy in the system that, as I said earlier, we got doctors and nurses and also others who don't ever see a patient. And they're actually making policy about patients. So this is crazy. So, yeah, we're going to make it better.
One last question, Doug. How did you learn to deal with the media like you do? I saw you on CNN one day. Take somebody who's read her the riot act. I mean, just let her have it. And you were right, 100% right. They've been pushing more disinformation about you, about Trump, about veteran care, about Medicaid, Social Security, Medicare. They're just lying. And you don't seem to have a problem because a politician might back off and you maybe didn't get that perfectly right. You said, answer my question. Yeah. And you're letting the reporters have it. At what point did you say to yourself, I've got to do it this way to get my point across?
Because I'm not going to this reporter in particular was warned, I'll answer a off VA question to start with.
Right.
And then I said, if you continue, I said, I'm not going to answer.
Right.
So I gave him 3 shots, 3 strikes, you're out of my ball game. And I just said, okay, if you're not going to answer my question, I'm going to at least ask you why you're disrespecting my veterans and stuff like that. So it's just a matter of fighting back. And I think that's one of the things I told my VA, you're not going to scare my VA, you're not going to scare my veterans, and you're not going to scare my employees without having to deal with me.
I mean, listen, I think you're doing an amazing job. I love that you're our voice out there. My dad died at the VA in Miami, but he was a great veteran who loved the VA. I know that you're going to bring it back to its an incredible status that it used to have, and it's going to be more efficient going forward, too. Doug, thanks a million for coming on today.
Appreciate it.
Appreciate you. Want to hear your comments, want you to like it, want you to share it, and don't forget, come on!